My name is Nancy Wallace, and I am the UN main representative for the world. I'm the main representative for the to the UN for the World Federation for Mental Health. And I just wanted to tell you just a little bit about WFMH. We are a global mental health organization. We were founded just after the UN was formed, and we've been in consultative status to the UN since 1963. So we've been here for quite a long time. We started doing active advocacy in mental health starting in about 1991, and a number of us were actually at the Beijing conference in 1995. Several of us, my colleague Ricky Kantrowitz, who's sitting here, and several others, including our president, Beverly Long, were very active in advocating for the inclusion of mental health in the Beijing platform. When it started to be written in 1991, or 1992, I guess, is when they started working on the recommendations of the Beijing platform. There was nothing in the platform on mental health, no information no references to psychological care, no anything related to mental health. And as a result of the advocacy from WFMH and a number of other organizations, we were able to get some language on mental health into the Beijing platform for action. And I think that it speaks well to those of us that were here and are here, that how important it is to take action and to do advocacy to your governments, to come together as NGOs and work for the inclusion of mental health in every area that we work with. And today, I'm so pleased to see everyone here and the numbers of people that are here for this program. But I'm especially pleased that mental health has really has a higher level of recognition throughout the UN now. There are many efforts going on. Just recently, there was the a resolution to make International Day of Hope, which is Catherine Getz here, was one of the leads, or was the lead, in getting that resolution passed. So we're very pleased and really thankful for her for being able to get that day passed. And I just want to encourage all of you to think about wherever you work, wherever you are. If it is not affecting you, mental health affects you personally, I'm sure that someone in your family or friends or in your community have mental health problems. And it's important for all of us to think about what we do at work, how can mental health be integrated into the work we do. It's important to have that consciousness, and it's so important for us to stand up and have our voices heard around the issues of mental health, and making sure that our governments in particular take notice, provide funding and services for people who really are in need. It particularly affects women, as we know, and I am particularly concerned with the issues around violence against women, and it's very important that we incorporate a mental health perspective in every aspect of the work we do around violence against women. So I'm going to introduce our next speaker, who is Jullie Millard, and Jullie is on the board of WFMH, World Federation for Mental Health. It's been my honor to be able to work with her. She chairs the women's section of WFMH, and she's done some remarkable work with that. And they have regular webinars, which I encourage you to go onto the WFM's website. And if you're interested, please give us your emails and your contact information so that we can add you onto the list so that you can participate in the webinars.